A sudden crushing weight on your chest. For anyone over 60, this moment of terror could strike anywhere at any time, and you might be completely alone. Your mind might have just 10 seconds of clarity before confusion clouds your judgment. What you do next will define everything. This is not about fear. This is about a plan. A clear, step-by-step sequence of actions that are proven to save lives when a heart attack strikes and you are by yourself. Let's walk through exactly what to do. Recognizing the silent signals. First, you must understand that a heart attack often whispers before it screams. It does not always arrive as a sharp, dramatic pain in the chest. Especially for seniors, women, and those with diabetes, the signs can be deceptively mild. You might feel an uncomfortable pressure, a squeezing sensation in your chest that comes and goes. The pain might travel, showing up as an ache in your jaw, your shoulder, or down your left arm. You might suddenly become short of breath, break out in a cold sweat for no reason, or be overcome by a wave of nausea or dizzying fatigue. If something feels profoundly and inexplicably wrong inside your body, you must trust that instinct immediately. Your life depends on it. Your first and most critical action, the very first thing you must do before anything else, is call for help. Do not wait. Do not try to convince yourself it is just indigestion. Do not worry about being wrong. Dial your emergency number 911 or its local equivalent the moment you suspect something is wrong. Every single minute that passes means more of your heart muscle is being starved of oxygen and dying. Keep your phone charged and within reach. Have your emergency contacts listed clearly in your phone. The single greatest mistake you can make in this situation is to delay, hoping the feeling will pass. The golden hour. Why speed is everything. Medical professionals call it the golden hour, the first 60 minutes after a heart attack begins. What happens during this window determines whether heart muscle is saved or lost permanently. Every 30-minute delay in treatment increases your risk of death by 10%. When you call emergency services immediately, you start the clock on advanced care that can begin the moment paramedics arrive. They can perform an EKG, administer oxygen, and alert the hospital, turning your ambulance into a mobile emergency room. This is why waiting to see if it gets better is so dangerous. You're literally watching your golden hour tick away. Your quick action saves lives. Your subscription helps us spread this message further. Help us reach our goal of 1,000 subscribers to continue our mission. Thank you for your support. The power of a simple pill. While you are on the phone with the dispatcher or immediately after you have made the call, you need to take one specific medication if it is available to you, a regular, chewable aspirin. Do not swallow it whole. Crush it with your teeth and chew it thoroughly. This allows the medicine to enter your bloodstream rapidly, where it works to thin your blood and help shrink the deadly clot that is causing the heart attack. It is a good practice to keep a small sealed packet of aspirin in your nightstand or wallet. Of course, if your doctor has explicitly forbidden you from taking aspirin, you should skip this step. The life-saving position. Your next move is about posture. Do not stand and do not walk around. Carefully lower yourself to the floor and sit with your back leaning against a wall or a sturdy piece of furniture. This sitting position reduces the strain on your heart. More importantly, if you were to lose consciousness, being on the floor prevents a dangerous fall from a chair or bed. Do not lie down flat, as this can make it harder to breathe and can actually increase the workload on your heart. Leaning forward slightly can also aid breathing. The dangerous myth you must avoid. There is a dangerous piece of misinformation that circulates online, and you must know to ignore it. It is called cough CPR, and it involves taking deep breaths and coughing forcefully. Under no circumstances should you attempt this if you are alone and having a heart attack. This technique is only used in a very specific hospital setting for a different heart rhythm problem. During a typical heart attack, it is completely ineffective. It will only waste your precious energy and oxygen, and it delays you from taking the actions that truly can save your life, like calling for help and taking aspirin. Stick to the proven medical protocol. Simple acts that save precious time. Once you have called for help and taken your aspirin, there are small but critical things you can do to assist the paramedics who are on their way. If you are able, crawl or walk to your front door and unlock it. If it is nighttime, turn on a porch light. This simple act can save paramedics from having to break down your door, shaving vital minutes off their response time. If you have a smartwatch, use its emergency SOS feature to alert contacts and call for help. Use voice commands on your phone. Make sure your phone's medical ID is set up so first responders can see your health information without your passcode. Calming the storm inside. In the midst of this crisis, your body will be screaming with panic. But panic is your enemy. It forces your heart to work even harder. You must fight back with your breath. If you are feeling short of breath, focus on a simple pattern. Breathe in slowly through your nose for a count of 3. Then breathe out even more slowly through your mouth for a count of 6. This deliberate, calm breathing can help slow your racing heart and conserve its precious oxygen. The ultimate survival strategy, prevention. The very best way to survive a heart attack is to prevent it from ever happening. These events are rarely random. They are usually the culmination of years of silent development. If you are over 60, the most powerful thing you can do is have an honest conversation with your doctor about your personal risk. Know your numbers, your blood pressure, your cholesterol levels, and your blood sugar. Ask about tests that can look inside your arteries to see if they are becoming clogged. Taking control of your heart health today is the most important step on this list. Create a heart attack survival kit. Prepare a small kit today that could save your life tomorrow. Keep these items together in a visible, easily accessible place. Chewable aspirin in original packaging. A list of your current medications and allergies. Your doctor's phone number and emergency contacts. Your insurance card photocopy. A brief medical history note. Store one kit by your bedside, another in your car, and tell a trusted neighbor or family member where to find it. This simple preparation takes minutes but can save crucial time during an emergency. If you're behind the wheel when warning signs strike, your only mission is to pull over safely and immediately. Activate your hazard lights, call emergency services, and wait for help. Never try to drive yourself to the hospital. Every moment spent driving is a moment your heart isn't getting the help it needs. Those first 60 seconds during a heart attack will define your future. What you do or don't do can change everything. This knowledge isn't just information, it's protection, it's confidence, it's what stands between fear and survival. I'm asking you to share this video with 3 people over 60 who matter to you. This simple act could be the most meaningful gift you ever give them. We're working toward our first big milestone of 1,000 subscribers. Every subscription helps us create more life-saving content that reaches those who need it most. Now I want to hear from you in the comments. Which piece of advice from this video hit home the most for you? Who was the first person you thought of while watching this? Your experience could help others recognize their own risks. If you believe in turning knowledge into action, join our community. Subscribe and like this video to help spread these vital messages further.